Good morning. This is Alex Stockton. You are watching MSUD News. Today's top story is about an infant that survived MSUD. Before we get to the scene, here's a clip for what
This
MSUD is.
video is about maple syrup urine diseases, how it is inherited, and what it can do to your body. Maple syrup urine disease, or MSUD, is a genetically inherited disease that is caused by mutations in the BCKDHA, BCKDHB, DBT, and or the DOD genes. These genes are responsible for breaking down the proteins in your body. If you didn't have these genes, then there'd be too many amino acids in your body and it could cause some serious damage to important organs such as the brain and the liver. If you look in the graphic below, you can see an example of how a mutation could occur resulting in MSUD. MSUD is an autosomal recessive disease. If you look at the pedigree, you can see that the amount of affected males and the amount of affected females are about the same, thus showing it is an autosomal recessive disease. Also, we can tell it is a recessive disease because of the genotypes. All of the affected individuals have two recessive alleles, therefore making a recessive disease. Now, in order to clarify how a disease can be passed on even though none of the parents have it, we have a pedigree set up showing you how offspring can inherit MSUD even when the parents do not have it. In this case, both parents are heterozygous, which means they are carriers, but they do not actually have it themselves. In the first square, you can see that there's a 25% chance that the offspring will get two dominant alleles. This is the best thing that could happen, for this would mean that the offspring would not have the disease, and their offspring will not either. The next two squares show the most commonly occurring results. In this Punnett square, 50% chance that the offspring would have one dominant allele, one recessive allele. They would be just like their parents, where they would not have the disease themselves, but they could pass it on to their offspring. Finally, in the last square is the worst possibility. When the child receives two recessive alleles, which there's a 25% chance of doing so, they would become affected and they would have the disease. Okay, so now we know how you can get the disease. But what does it actually mean to have the disease? Well, MSUD mostly attacks the nervous system, primarily the brain, which is shown right here. However, it does affect the other nerves in the body. We'll talk about the brain in about a minute or so, because right now let's focus on the nerves, because when the MSUD is in a person, the MSUD can deteriorate the brain, therefore making the nerves not work right. And this can result in seizures and muscle contractions that are very abnormal. Moving on to the brain, we can see that there are two main things that can happen to the brain. First off, MSUD can cause brain swelling. Also, like I said previously, MSUD can disintegrate brain cells. Let's look for an example of each. On the right side is a normal brain. Take a look near the bottom. You may notice that there's a part there near the bottom that is pretty healthy. Now take a look on the left at the left brain, the MSUD one. You may notice that part is completely gone. That is because MSUD has deteriorated the brain in that area. Also, you might notice that in the middle, in the normal brain, it seems normal. Normal amount of brain matter. Whereas on the left side, there is brain matter and a lot more there. That is due to brain swelling. Also, if you look at the very inside perimeter of the skull in the normal brain, you can see that it's pretty normal. But in the MSUD brain, it's cramped up right against the sides of the skull. Well, this is basically what maple syrup-driven disease is, how it can be inherited, and what it does to the body.
And now FCB news reporter Connor is live at the scene. What do you want me to do?
Thank you, Alex. Right now, I'm sitting inside the doctor's office while all this took place. Last night, around 10 o'clock, little Jimmy arrived at this hospital in serious condition. He was constantly vomiting and has abnormal muscle contractions, and it wasn't until the doctors checked him out that they found out he also had brain swelling. Earlier, I asked the doctor some questions. Good morning, Dr. Richard.
Good morning, Connor.
Thank you for this opportunity to talk to you about Jimmy. Now, let's start off with the first question. Who all is affected by this disorder?
This horrible disorder mainly affects infants that are Amish, Mennonite, or of Jewish heritage.
Now, here's a question that everyone is wondering about. What is the prognosis of this disorder, and what is the life expectancy?
This disorder can be life-threatening if left untreated. The best way to battle this disorder is by having a strict diet, but even with dietary treatment, stressful situations and illness can still cause high levels of certain amino acids. Sadly, these episodes may cause death. But if children stick to the strict diet, they have a chance to grow up into adulthood and can remain healthy.
Here is another important question. What are the symptoms of the disease?
There are many symptoms, but here are a few of them. Avoiding food, coma, feeding difficulties, lethargy, seizures, urine and sweat that smells like maple syrup, vomiting, brain swelling, difficulty breathing, abnormal muscle contractions, irritability, and developmental delay.
What are some treatments for this disorder?
The treatment for this disorder involves eating almost protein-free diet. This means you can't eat nuts, meats, or eggs. If you don't take enough protein each day though, your body will start to break down your muscles and to get these proteins, which will result in increasing weakness. You would also be more probable to get infections because your immune system wouldn't be able to produce enough antibodies. Most of the fluids and sugars and fats are given to you through an IV. Peritoneal dialysis can be used to help reduce the levels of abnormal substances. For people that don't know, peritoneal dialysis is when doctors put a permanent tube in the abdomen where fluids are introduced in the abdomen and flushed out either every night while the patient sleeps or via regular exchanges throughout the day.
Thank you for your time, Doctor. We will keep you updated on Jimmy's condition. And now, back to you, Alex.
This is a very tragic story, but we are out of time, so this is FCB News.